Hi, my name is Tiffany, and this is for my communications class. The topic of my speech is to focus on common healthcare killers that might not be known to young adults, so ages from 20 to 30. We will be focusing on high blood pressure, high cholesterol, and osteoporosis, and how we can combat it at a young and able age. We will go ahead and start off with high blood pressure. What is high blood pressure? So, we might have heard about it from our parents or grandparents coming home from the doctors saying that they had a high blood pressure reading in office. But what exactly is it? So, high blood pressure is when the pressure of the blood pushing against the walls of your blood vessels is too high. But why is this bad? Well, having high blood pressure for a long period of time can cause many complications and can lead to heart attacks, stroke, aneurysms, heart failure, kidney problems, eye problems, metabolic syndrome, and dementia. So, how can we avoid getting blood pressure? What are things that we can do at home or in our day to day life to kind of avoid getting it? So, one of them being exercising. Second is avoid or watch your salt intake. Avoid drinking alcohol in excess, and avoid smoking. Next, we will discuss high cholesterol. Understanding cholesterol is somewhat confusing. If you've ever taken an anatomy or science class, you know that there are 3 types of cholesterols, and one of them is labeled good and one of them is labeled bad. Well, we as humans need cholesterol to survive, but many don't know is that our body provides us with all the cholesterol that we need. When we eat in excess of cholesterol, this is what can lead to problems within the body. High cholesterol leads to plaque buildup inside of your blood vessels, also known as atherosclerosis. This can lead to CAD or coronary artery disease, heart disease, or even a stroke. How can we combat getting high cholesterol? Although there are some conditions in place that places you higher risk of getting high cholesterol, like HIV, AIDS, hypothyroidism, lupus, and diabetes. Those who do not have a pre-existing condition can, in no surprise, eat healthier, exercise, avoid drinking alcohol in excess, and avoid smoking. Lastly, we'll be discussing osteoporosis. This is something many of you may have not heard about unless you work in a doctor's office or know someone who is diagnosed with it. Osteoporosis is a bone disease. It is known to weaken your bones, making you more prone to broken bones. This occurs when the replacement of new bones doesn't keep up with the loss of your old bone. And the Mayo Clinic listed a couple of different things that we can review that so there are some pre-existing conditions that put you at risk as well with osteoporosis. So one of them being sex hormones. So when a woman goes through menopause, it can cause the bones to weaken due to the lack of estrogen in the body. Low calcium intake. When we are younger, we are taught that to drink all our milk because it will help straighten our bones. But as we get older, there are no commercials, we are not taught that we need to keep drinking calcium. And then lastly is prednisone and cortisone injections. Many of you may not have heard of this unless you work in a doctor's office or have received one yourselves. So when you have arthritis or your joints ache, a lot of providers recommend getting a cortisone injection because this can lessen the pain and can kind of delay you from getting started on any narcotics like oxycodone, which is what a lot of doctors avoid putting patients on. With osteoporosis, there is so much that you can do, but people don't know. So one of them is avoid sitting all day. So if you can, for example, me at my job, I sit a lot because I work an office job, me and my friends or coworkers, we decide to go on a walk around Wright Park for 30 minutes minimum to kind of help us stretch our legs and build that bone that we lost back. And then, no surprise, once again, is avoid smoking and drinking in excess. It also helps to do weight-bearing activities. So at home, when I cook, I also have weights. So I have weights, and in between, like while I'm cooking meat, I do simple exercises like this that can help limit me getting osteoporosis in my upper body, but also just in general to kind of stay healthy when our lives are so busy. And then lastly, you want to increase your calcium and vitamin D, whether it's taking supplements or the best way is finding it in your food. If you have a chance, definitely avoid taking any supplements and eat it through what you can in your food. Like for calcium, drink milk, Greek yogurt, stuff like that. So for me, I have been working in healthcare for about 7 years, and I know very little about these conditions prior to working in healthcare and having struggled with my own health issues as well. It's just really hard to know about these unless you're told. So definitely avoid smoking, avoid drinking alcohol in excess, especially from the age of 20 to 30, which a lot of people don't want to hear. And just be active. There are so many things that you can do that you don't even realize that you might enjoy. Go for a 30-minute walk in the middle of your day. It will help your mood. It will lower your blood pressure, and it will help you delay getting osteoporosis. Or just go to the gym. You don't even have to do a lot in the gym. You can go to the gym and work out by walking on incline. That not only helps your cardiovascular health, but it also helps you build muscle in your legs when you're working out in an incline. So yes, thank you.